Good morning, everybody. My name is Ivan Núñez, and I want to be a doctor, and finally, a cardiothoracic surgeon. First of all, I want to study and finish medical school. Afterwards, I will specialize myself in cardio, which for me is the most important ramification in medicine. This is the ramification that studies the heart and the thoracic surgeon of the human body. Then, when I have my degree, I will study again to be a surgeon in the cardiothoracic area, which is my favorite. Hopefully, the clinical study will help people who are underneath the transplant list, and that way we can lower the average of diseases in the OR. I decided to be a doctor and a surgeon because I saw someone on the floor bleeding and dying, and no one was helping him. That's the principal reason because I decided to do this for the rest of my life, and because it's a way of living, it's not a simple job. Another important goal that I can achieve is to have an interview for applying for the job of the chief of surgery at the hospital. Obtaining this place will be really exciting for me because the chief of surgery is the most important doctor over all the surgeons. It's the most important place in the hospital. In other words, it's the boss because it takes the hard decisions over all the hospital. The principal decisions could be decide which OR to use in an emergency, think how to handle the arrival of injured people to the hospital, and call infection control to control the spreading of the virus between the hospital, doctors, and patients. Having this hard job, I have another interview to become part of the hospital's board, which are all the people who take the principal economic and social decisions over doctors, patients, and all the hospital. Some examples of these decisions will be decide how much money goes to the department. For example, if they want to do a clinical study, they have to decide if it goes to cardio, to ortho, to neuro, or to pediatric. So in that case, they will decide the best study to improve all the hospital. Also fixing problems with social services. For example, if a boy enters to the hospital with an overdose of lorazepam, they have to study the case and research the family to see what happened. In that case, the first thing that the doctor has to do is to contact social services and diagnose the cause of the overdoses. Being a doctor, surgeon, chief of surgery, and a board member of the hospital is a long way to go through, but with effort, compromise, and strong convictions, I am sure I can also get to have my own hospital with different clinical studies that would change the face of medicine. Counting for sure, my own clinical study, which I mentioned it before, but I'm going to explain it more to give more details about it. This isn't a normal study. This is a specialized clinical study where we're going to use 3D printers to print little by little parts of the human body heart, and that way, after printing little parts as the mitral valve and the veins, and that way we can assemble with a group of surgeons the heart completely to be completely functional, and that way it will have the same characteristics as a normal heart. This will be for sure the principal study that the hospital will present to the main board. In that case, we can extend our printed hearts to all the hospitals in the country, and that way saving tons of lives at a time. For me, as a surgeon, the most important thing will be to get out of the OR and tell the family that we could save its son, its daughter, its grandpa, or its friend. Finally, after reaching these goals in the professional aspect, I will have my own clinic study, which consists in printing functional cards with its mitral valves complete so it can help to people that need a heart transplant. So basically, this study will consist in replacing an unfunctional heart with a functional heart to restore the vitals in an OR.